So we'll kind of just motion the knee with different angles, different pressures. This is going to improve the mechanics of the knee. In any areas where we see a little bit of restriction, we just give it a little bit extra and get it to release. Hi guys, Dr. Randy, Kalkstein Chiropractic. Got Kimberly in the office today. We're going to do a knee adjustment. We're going to show you a knee treatment today. She fell on her knee recently, right? When did you fall?
A little while ago.
A little while ago, but it's bothering her again. So we're going to show you how we work on the knees. She's been a patient. We're also going to do her neck and low back. What else is that's the main thing that's bothering your neck and knee today? Mm-hmm. Okay. Anything else?
No.
All right, let's do it. Go face down for me. All right. So, any low back or hip pain?
No, just a little bit.
Just a little on the hip. Yeah. We think maybe the hip and the knee are correlated. You think, right?
Yes.
They kind of come together. You'll notice some knee pain
yes.
with the hip pain. That's pretty common. It's called a closed kinetic chain. So if somebody has, let's say, ankle or knee pain, the hip's going to be affected, right? You can't really affect one joint without affecting all three. It could be because you have some pelvic misalignment. There could be a lot of different reasons. In her case, she's had some old injuries in her knee, correct?
Yes.
Okay, so you had some wear and tear issues. Ran track in high school, you said?
Yes.
And just since then, what have you been doing to it? It just kind of flares up from time to time?
Right.
Got it. So we haven't really worked on her knee, although it's been bothering her, but we've been doing her low back and neck, so we're gonna do that first. As always, in our office, we do the soft tissue first. I, as the doctor, get in and work on, like, she's really tight QL muscles, which are these paraspinal lumbar muscles. I'll probably work more on this after. We'll kind of get right to the adjustment part. Always checking leg length. There could be some pelvic misalignment. In her case, she does. It's a little bit of a right leg short. We bring them up and they go even. What that means is her right SI joint is stuck in extension. So her ilium rotates back, pulling her right leg up a little bit. It's only about a ½ inch short, but that's a big deal when you're taking 10,000 steps a day. So this ilium's an extension. The way we correct that is we have drop tables in each room, so it's very comfortable for the patient. We just do some light drop work on her right SI joint, taking the extension out. Can I just pop there a little bit?
Yes.
Sometimes even with the drop work, we're going to get a release. So we got that joint to release, which is great. We're always bringing the sacrum back into flexion because a lot of people on their feet too much, and we get that like extended curve in your low back. So the drop work helps you flatten your low back out. In her case, she has a little, and just sometimes just that little bit of drop work can even things back up. Now it may not hold. That's where stretching and exercise on your own, and we can give you those things help. Or sometimes regular adjustments are needed because your muscles, to sort of retrain the muscles to hold her adjustment. Take a deep breath in for me, Kimberly. Exhale all the way out. Good. So we're just getting her mid back. She moves real nice, and we're gonna do some more muscle work. And it's also the right side of your neck, correct?
Correct.
So again, she's wondering if it seems to be always the right side, neck, shoulder, hip, and then also the knee. And that's possible. Things can just affect certain sides of the body. Could be overcompensating, and there could be a lot of reasons for that. She has tight traps. We all hold a lot of tension in our trapezius muscles up through here. It's a technological world we live in, so we're always on screens, computers, phones, traveling, and the shoulders become rounded, the neck goes forward, and everybody's so tight through here. I can almost guarantee that everybody that walks in my office is going to need an upper thoracic adjustment up here and an upper cervical adjustment, just because of the nature of the postures people are in. The tricky part about up here is you may not feel a lot of pain because it's not weight bearing. Whereas her hip and her knee are weight bearing, she's going to notice that almost every step she takes. Your neck and shoulders, you may not realize that because it's not weight bearing. That's why coming in to get it checked and adjusted, I can palpate, and I may hit a spot up here that's super tender, that needs adjusted, that's causing a problem that maybe you didn't know was even there because, again, not a weight-bearing joint. Take a deep breath in for me, Kim. Exhale. Good. And this side, deep breath in again. Exhale. Good. little more drop. So far, so good. Go on your
Yes.
back for me. Cross these arms. Breath. Roll towards me. And right back on my hand. Good. Last one. Okay. Excellent. Good. So we're going to get your neck adjusted. Just relax your shoulders for me. Neck adjustments are great for headaches, migraine headaches, tension headaches. We're seeing a lot of that lately with the heat. Again, obviously neck and shoulder pain, upper back pain is going to help. Sinuses is a big thing. You know, we can do some sinus work on patients after they get their neck adjusted. You know, dizziness, all that kind of stuff. We always do a little decompression. Pick your head up for me. Relax your neck. Good. So this is really going to help her neck pain. It's a good complement to just the adjustments. We're adjusting the joints. We're getting them to release and move. Now we're going to distract. Take some pressure off the intervertebral discs. Allow more oxygen to get to them. Just keep her discs healthy. It's going to keep her spine healthy. Some patients will feel this all the way down their spine, all the way down their back. All right, so now we're gonna move to the knee. So a couple things we'll do. So first thing, I'm gonna have you hold onto the table. I've done this a lot. I'm gonna, yep, perfect. But relax your hip and knee.
Okay.
This is just a long axis distraction for the ankle, knee, hip. Same thing here, relax your knee. Now specifically, it's nothing with her left, correct?
Right.
It's all right. So I'm gonna do it. So we kind of get in and we kind of do like a little, what's called meniscal release. So we'll kind of just motion the knee with different angles, different pressures, looking for any adhesions that are built up in the ligaments and tendons that surround the knee. We'll give you, hang on there again for me, Kimberly. Another little distraction. And I'm going to flip over on your tummy one more time for me. Big thing with knee pain, and we see it a lot in the office, is tightness back here in the calf, especially on the fibular head. So what we'll do sometimes is do a little bit of ART on the fibular head, and we'll just kind of hold pressure. A lot of people with the knee aren't stretching enough, not doing their calf, their quad, their hamstring stretches enough, and so their knee is taking the brunt of that. And so we're just holding a light pressure and doing a couple rotations back on her fibular head here. This is going to improve the mechanics of the knee. We're on her gastrosoleus muscle. Again, just doing some light ART, active release technique. We're feeling for any knots that are built up. Okay. We'll even take some lotion sometimes and just kind of, just like we do for her back and neck, we'll just strip down muscle inflammation. We're going to do that around the fibular head here and the calf muscle. Okay. Any tenderness there, Kim?
No.
Addressing the soft tissue around any joint pain is so key, because a lot of times joints, this is particularly important with the spine too, joints aren't firing and functioning the way they should because the soft tissue around it isn't healthy, let's say. So just kind of stripping that soft tissue out, stripping out adhesions and knots, really is going to get a lot of joints to function better. Okay, so we're going to do a little bit of that. Now I want you to sit up again, and you can sit facing me this way. I'm just
Okay.
Yep. We're going to do your shoulders and knees sitting up now too. So again, one of our original problems was the shoulder neck, so we're going to do that shoulder adjustment. Just relax your shoulders for me. Perfect. And this one here, relax the shoulder. Good. And that's our glenohumeral joint clavicle adjustment there. Yeah, we're going to get back on the right knee again, and we're going to do that meniscus mobilization. I kind of hold the knee, give a little distraction, and just a little motion. It's more of a mobilization than it is an adjustment. And for her, she's having that pain right at her quad. So we're going to move that patella around. In any areas where we see a little bit of restriction, we just give it a little bit extra and get it to release. Good. And then we're going to go over some stretches for her knee in terms of her calf and quad and hamstring to help that. So that's her basically full spine and right knee adjustment for today. So thanks for watching.